Kempner at Duke University found if the adult human will exercise 4 times a day, the body just works better. Melinda found if you exercise just 20 minutes, it lowers that blood sugar more than 1 shot of insulin. That tool right there is amazing. I'm working with a guy right now. He has marked improvement. This afternoon, we're looking at what to do for your health concerns in a time of no buy, no sell. And as we began, we looked at how we can proactively address health so that we don't have to get into, hopefully, a bad scenario, especially with chronic diseases. There are times we have cuts and scrapes and, acute issues that happen to us. But the goal is to be healthy so we're less prone to have health issues. We started off today looking at the 10 major causes that people go to a physician's office, and we'll continue that at this time. Let me swap over to the PowerPoint. So the next item we want to look at is hypertension. That's a second major cause that people are having challenges with going to a physician. The biggest thing is on hypertension is you want to identify what those root causes are. The primary cause of hypertension, the number one cause of hypertension in the United States, is stress. Stress raises cortisol, stress lowers potassium, blood pressure goes up. And so you want to address issues that may cause stress. And again, trust in God. And during that time of no buy, no sell, it's going to be a challenging time as we've gone through some issues over the last 2 years. I think it's an issue of travail. We went through initial stress, then it backs off, then we have more stress, and it backs off, and the Bible talks about travail. And so as we go into a time of no buy, no sell, it could be an escalation of stress, and then we get used to it, and then we come down, and just as my daughter Ashley's about to have a baby in a couple days, she will go through travail. She's already having, some little contractions every once in a while, and they'll definitely crescendo over the next bit as she comes to that time. And so as we look at stress, trusting in God is huge. And then the lifestyle, adequate water and getting your rest and exercise. And yes, there's things like B complex and lithium orotate and magnesium and those things, but are those going to be available? And I'm going to mention this afternoon some of the supplements that we use, but some of them we may have left over, but then we may not be able to get any more. So then we need to look at the herb side, things that we can go out and pick that may help. Valerian, skullcap, hops, passion flower, chamomile, those things are wild lettuce even that can help calm a person down where they're not having that issue of stress. Lavender, vetiver. The next one is dehydration. Dehydration, when a person's dehydrated, their blood is thicker, it's stickier, causes the pump to pump harder. The brain has less water, and therefore you're more prone to stress. Your kidneys aren't working as well because it takes water to run the kidneys, and the kidneys are the switches that run blood pressure. It's through urination that we get rid of salt. So when we're dehydrated, the hypothalamus thinks we need to, there's a drought, so hang on to fluids and retain fluids. And so then we're not getting rid of the sodium. And another thing that happens in dehydration, our body has electricity. It's called conductivity. If it didn't, EKGs wouldn't work. And so what happens is, in going back to basic chemistry class, remember when the professor had a flask and he had distilled water in it, and he plugged a light bulb in and cut the wire, and he stuck it one end in the water and the other end in the water. The neutral was plugged up, and the light bulb would not light up because we don't have current flowing through because there's no mineralization there. So he starts pouring salt in the water, and as the salinity goes up, then the light starts coming on. And then he starts pouring distilled water again. So our salinity goes down, the bulb gets dimmer. The same thing is true in our body. When we are dehydrated, the mineral content, the salts, especially salt, but the minerals are higher. Therefore, we're more prone to hypertension and other cardiac issues. As we drink more water, that comes more to normal. But we can actually drink too much water and it goes the other way. So adequate hydration is very, very important for managing hypertension. Ideal body weight, and there's a lot of research on that, being in the ideal body weight to help address high blood pressure. Kidney function, again, the kidneys are the switches that run the blood pressure. And so you want to make sure you're having good kidney function, adequate hydration. If you don't, there's things that you can use like corn silk tea, dandelion root, excellent for kidney function. You can add some activated charcoal. You can add some CoQ10, do the Duke diet, which is the brown rice and fruit for breakfast, brown rice and salad for dinner, the noon meal, exercise. Those are amazing for improving renal failure. Making sure you're not having too much sodium. And if you do sodium, it's going to be better if you use the more natural, such as the Himalayan salt. Atherosclerosis. Atherosclerosis is clogged arteries. And if you have a pipe and you want a water hose, and you want to generate more water or pressure, then you put a tip on the end that has a smaller orifice and you get a stronger pressure to wash your car. Well, when you shrink that orifice in the pipe and you go down, you're going to increase the pressure. And that's what happens with clogged arteries, atherosclerosis. Arteriosclerosis. Arteriosclerosis, that is an issue of where you have a vessel which is expanding as the heart beats, and then as it beats, you lose that pressure. You don't have that increased pressure because your pipe's increasing. But if you have a rigid pipe, then every time that pressure goes up, you're going to have a higher internal pressure. And as we have hardening of the arteries, then it's going to increase pressure in the vessels and the vascular system. The other one is if there's heart issues, and so that can be another issue, and such as here. So what do we do for that? Again, we have the things for stress, the dehydration, drink more water, come into ideal body weight. We mentioned the things for kidney function, the salt, just have the proper amount of salt. Atherosclerosis, the best way on atherosclerosis is eat a whole food plant-based diet. Both Cornell University and Cleveland Clinic proved that with a whole food plant-based diet, cutting out the dairy, cutting out the meat, and also cutting out the oils, no nuts, then we see that we're able to have less plaque. Also, when you look at atherosclerosis, what's some other causes? Inflammation. And, so it could be because you have sleep deprivation. It could be because you have processed foods. So there's a number of things that can cause atherosclerosis. You can have atherosclerosis and have an occlusion and die, have a massive myocardial infarction because you have sleep deprivation. And that's very clearly documented by Harvard. And the person didn't, the root cause was not died from a heart attack, it was died from sleep deprivation. Because when you have sleep deprivation, you increase your C-reactive protein. As CRP goes up, you then have inflammation and scarring of the vascular walls. When you scar those vascular walls, then our normal level cholesterol will come through and start coating, trying to repair that. And then after a while, you start having plaque buildup, and then you have atherosclerosis. And so another thing to help with atherosclerosis is where you can use lecithin granules. It's a great tool. I call it Drano. A tablespoon 3 times a day. Amazing. I had a lady come in, both carotids were 75% occlusion, and just in 2 months. She only did a tablespoon twice a day. At that time, I didn't know we could do it 3 times. Now we do it 3 times a day. Totally safe. But at that time, we were doing it twice a day. And in 2 months, she went to both mid 20% occlusion. Very fast. And so that can help with the atherosclerosis. Help with the atherosclerosis, you're going to help with the arteriosclerosis. If it's heart issues, probably the best thing I've found is hawthorn berry. Hawthorn berry works like 3 different types of blood pressure medicine. But always remember, hawthorn berry has a 4-hour half-life. So it's better to give 1 hawthorn berry every 4 hours, or 2 hawthorn berries Q4 hours, or every 4 hours. Routine health maintenance is another issue where people come in to the doctor's office. And routine health maintenance, that, basically you need to investigate New Start lifestyle. And so if a person comes with just routine health maintenance, look at each one of those laws. Are they eating healthy? Are they exercising? Are they having adequate hydration? Do they get sunshine? Are they making right decisions? Are they smoking? Are they drinking? Are they whatever they might be doing wrong? Illicit drugs. Are they in pollution? Are they getting their sleep at night? And then do they trust in God? It's kind of like a routine health maintenance, routine maintenance on your car. You go in and you check it to make sure it's, that it may need greased, or it may need tires rotated, check your fluids. The same thing true here. And basically, maintenance is New Start. Arthritis. Now, we see a lot of arthritis out there, and I'm seeing maybe even more arthritis out there. And you want to address the root causes. Number one, Dr. Agatha Thrash taught me that a major cause in North America for arthritis is the hybridized wheat. That 42 chromosome wheat is causing problems with arthritis. The combination of the 42 chromosomes, also the issue of using the Roundup. That's an issue. Another issue that can help with arthritis is water. And so you want that cushion in the joints. And when you don't have that cushion, you're more prone to have pain. And water can help lubricate those joints and put adequate water in those joints. Ideal body weight. If that person weighs is outside ideal body weight, and there's too much weight on those knees, on those ankles, on those hips, it can cause pain. And so coming down to ideal body weight is very, very important for arthritis. So those joints don't have to bear more weight than what it should be bearing. Boron can help. Folks usually do around 75 milligrams of boron. Some do 150 at the beginning. 75 is pretty normal. MSM is amazing. And you'll use like a teaspoon twice a day the first week, then go to 2 teaspoons twice a day thereon. I've seen men who work in heavy occupations need 2 tablespoons twice a day, but normally just 2 teaspoons twice a day does the job. The pills, when you buy pills in MSM, it's just not enough unless you take a whole bunch of them. There's several rules in MSM. You cannot use it with chlorine. Chlorine it neutralizes the MSM, and you can't use it with citrus. Citrus neutralizes the MSM. So if you are, let's say you're using it for breakfast, you don't want to have chlorinated water with it. You don't want to put it in orange juice or eat it within, that right after taking it, and eat some lemons. So you want to take it, say 30 minutes before breakfast, and then a half hour after, you can enjoy your citrus, your grapefruit, your oranges, whatever. But MSM is phenomenal. You can use it both by mouth. You can also use it topically, so it transdermally goes in. Does a good job. Turmeric. There's different ways of turmeric. You can do just the plain turmeric in your food, capsules. Then there's, you can also, on the turmeric, you can do, well, at this time, it's not really going to be accessible, so you want to grow your own turmeric. And this is a little confusing here because we're looking at a time of no buy, no sell. And so some of these items, like the boron, you may not have, and the MSM, you may not have access to, but definitely the water, the ideal body weight, the turmeric, you can grow turmeric. The wheat, just don't eat the regular hybridized wheat. Far infrared, you may not have access to. It's a great tool now that we're finding with arthritis, does a great job. Wild lettuce is a great painkiller. California poppy is another great painkiller. Jamaican dogwood is another good painkiller. And I mix them with skullcap. So here's what I do. I take a quart of water, bring it to a boil. When it starts to bubble, I turn it off, and I put 1 cup of wild lettuce, or 1 cup of California poppy, or 1 cup of Jamaican dogwood. Or some people will mix it. They may do a third, or a half and half of these and mix them up a little bit. But then we then add 1 cup of the skull cap. This is pretty powerful. You let it sit overnight. The next morning you strain off 1 cup and you drink 1 cup every 2 hours. If that does a great job and helps with the pain, then you can then go to 3 hours. If that works, go to 4 hours, and you go to least dosing that way. But these are very, very good for pain. Also, the turmeric is very good. And if you grow these herbs, start growing them now, get used to how to grow them and have those resources, then you'll have those painkillers when you need it and you can't buy and sell. Diabetes. I can remember I used to think diabetes could not be reversed. Type 2 can. And so if a person has diabetes and they're wondering, what do I do about my metformin? What do I do about my insulin? If they're type 2, then they're in good shape. We see over a 98% change, reversal of type 2 diabetes. Now, type 1 diabetes, it's not surprising for us to see someone taking 60, 80 units of insulin to go to 5 units of insulin a day. And that's remarkably improved. But I haven't found a very good way of totally going off the medication. That's the challenge when it comes to no buy, no sell. But yet, that's where we go to God. And we just say, God, I can't buy it. I don't know anything natural. Please help me out here. Whatever way he chooses, that's what he chooses. Type 1 is a tough one. And that's why we need to keep studying physiology. And I think we study pharmacology far more than we should. I think we're studying pharmacology to figure out how to treat signs and symptoms. We do a better job if we would study physiology to figure out root cause so we can know how to reverse those root causes. And then we don't have to use the medication. And that's what happened with type 2 diabetes is we found out what the root cause is, and then we get rid of that. And the 3 major root causes of type 2 diabetes is where the cell is too large and the insulin receptor doesn't work. All you have to do is shrink, come back to ideal body weight. The other one is where the insulin receptor is clogged up with fat, and it's because we eat a high-fat diet. We fry everything in the South: maters, taters, ice cream, pickles, cheese, chickens, all kinds of things. Poke, ramps, okra. Cheese, we fry it. If we can't fry it, we pour oil in it. And then we do all kinds of dairy. We do all kinds of meat. There's a lot of fat. And what's happened is that insulin receptor is just too clogged up with fat. And so what Duke University found was if you totally cut the fat out of the diet, you go to the Duke diet, that brown rice and fruit and brown rice and salad. We're not using avocados. We're not using olives. We're not putting salad dressing on there or oil, cheese or meat. And what happens is the body naturally just cleans that out. If we aren't still filling it full of fats, the body will clean those receptors out, and it does, cleans them out, and they start working again. The other cause of type 2 diabetes is where that third type is inflammation. And again, we talked about inflammation a few minutes ago. It could be sleep deprivation. It can be processed foods. Harvard says the #1 cause of inflammation in the United States is processed foods. So in that Duke diet, we don't have that. So when you're out, in the no buy, no sell, you're probably not going to have the deep fryer. You're probably not going to have the Fritos. And so eating that healthy diet, you're going to be able to clean that out a whole lot better. You're getting your sleep. Those items that cause stress makes a big difference when we eliminate those. So for type 2 diabetes, remove the causes. The diet that we talked about, a diet that doesn't have fats in it, doesn't have dairy, doesn't have meat, doesn't have processed foods. It's going to be raw fruits, raw vegetables, and you can do some brown rice for protein. Works extremely well. If you went to Duke, they'll charge you your first visit $13,000 to do this right here. Your second visit, and third visit once a quarter is going to cost you half that amount, and you can do it right at home. Exercise is very important. That's not very expensive. It's something you can do. Duke found that exercising 4 times a day, the body runs just a whole lot better. Then Loma Linda Medical School found that a 20-minute power walk lowers the blood sugar more than 1 shot of insulin. Well, that's pretty cool. So Kempner at Duke University found if the adult human will exercise 4 times a day, the body just works better. Loma Linda found if you exercise just 20 minutes, it lowers that blood sugar more than 1 shot of insulin. That tool right there is amazing. I'm working with a guy right now. He has marked improvement. He's still, he has got his blood sugar down, no medication. It's in the 90s, and we're managing it until we can get his weight down to where he's got about another 100 pounds to go. He notices if he exercises only 3 times a day, blood sugar goes up. So if he does that consistent 4 times a day, he stays on the diet, he stays on what he needs to do. But that exercise, if he misses that 4th exercise, blood sugar goes up. So I'm seeing it's really critical that Dr. Kempner found at Duke. You need that 4 times a day. Water, adequate water is important. Rest, get to bed by 9 o'clock. Herbs, Genema silvestri, excellent, probably the best one I know of for the pancreas and for helping with that stabilization of the insulin. So Genema silvestri, fenugreek, cedarberry, blueberry leaf, peachtree leaf, basil, holy basil. Those herbs are excellent to help to stabilize glucose. Or actually, it's stabilized because it helps with the insulin. Depression and anxiety is another one that folks are going into the doctor's office for. Depression, according to World Health Organization, is going to surpass the #1 diagnosis today. That's stress. WHO says that depression will soon be surpassing stress. And that was before COVID came out. So we've definitely seen a lot of depression in the COVID situation, especially in the early onset. We're going to see more depression come in as we're seeing, I was looking today at Europe and at the pound. Our ratio used to be like $1 of $1 US to 1.6 euros. 1.6 pounds. Today it's 0.85 pounds. And so they're having a terrible situation over in England right now with their economy. We're going to see that here. We're going to see that in America pretty soon. And that's going to cause depression. Anxiety, definitely increasing. And talking to physician friends of mine, they're telling me after COVID, anxiety is definitely increased in their patients. So what do you do? Number 1 is you want to manage stress. Stress exacerbates depression and anxiety. So manage that stress. Water, water, water. Water is so important for brain function. Dr. Walter Strachan from Loma Linda. If he took you on as a patient for depression, you had to drink at least a gallon of water a day. If you were a 100-pound lady, you'd still have to drink a gallon of water a day because he found that water is so important for addressing depression and also anxiety. Sleep by 8 to 9 o'clock. Some really good research out there on women's studies where they found if those women would go back to 9, even 8 o'clock at night, going to sleep, it helps. And I think a big part of that is we know that the hours before midnight are worth twice the hours after midnight. We also know the issue of the glymphatic system. From 9 to 10 o'clock, the brain does a deep clean. And from 10 to midnight, it does a thorough clean and flushing the brain. And if you're not asleep, that process is not taking place as well. Yes, exercise, they've now found, does help with the glymphatic system, but Harvard says we need both. We need that sleep by 9 o'clock. We need that exercise throughout the day. Those two together, it thoroughly cleans the brain. And if we're not doing that, it causes problems. And depression, anxiety is a brain thing. And you need not just the 8 hours of sleep, not just the sleep by 9 o'clock, 8 o'clock. You need that contiguous to figure out how to stay asleep. Exercise is important for depression and anxiety, especially with anxiety. As we see that roller coaster going up, if we can go out there and get that anxiety, that exercise going, we can see that cortisol drop. And so instead of a big roller coaster, we see that little roller coaster. And exercise really can help both with depression and anxiety. Again, going back to that Duke, Dr. Walter Kempner at Duke, Kempner says we need to exercise the human body 4 times a day. That definitely helps with depression. Sunshine. We need sunshine because we need to convert the the tryptophan that we ate in our flaxseed, which is the omega-3s that we'll talk about. We need that for depression, and we need about 2 to 3 tablespoons flaxseed twice a day. Grind, eat within 15 minutes. It's got that omega-3. It's got the tryptophan. So as sunshine comes through the eye, and that's where the sunglasses are a problem if you're wearing sunglasses. As the sunshine, the ultraviolet rays come into the eyes, stimulates the pineal gland to convert the tryptophan into serotonin. That's going to help with depression. It's going to help with anxiety. But then if we don't eat a large supper, and we don't, where we don't eat late, and we go to bed on time, then we'll produce that melatonin. And so that sunshine will help with melatonin also, where we're able to get that sleep. Get the sleep, which will help the depression and the anxiety. Magnesium to bowel tolerance. Magnesium is called the depression natural drug. Magnesium works very well for depression, works well for anxiety, and go to bowel tolerance. If you take too much magnesium, it gives you a loose stool, which we call green apple two-step. So get up to where you have a loose stool and then come back 10%. And then that significantly help with brain function, with the depression, with the anxiety. It also can help with your bowels. It can help with muscle cramps, a lot of things. And as we look back here, the sleep, the exercise, the water, those things, the sunshine, that's cheap. As we go into no buy, no sell, we may have problems with magnesium. Well, where do we get magnesium? Our green leafy vegetables. And so start looking at foods that have these vitamins in it and try to make sure that you have those available in your garden. The B complex, amazing for stress and anxiety. So look at foods that have the B vitamins. Lithium orotate, that's a tough one. It's amazing, works very well, but in no buy, no sell, that may be challenging. There are parts of the world that has lithium springs, which you can drink that water. You can take a bath in it, and it's free. Skullcap. I like skullcap. Dr. Strachan taught me to use skullcap for depression. It's an herb that you can grow, make a tea out of it. And so you'll take a quart of water, put you a third of 1 cup. Strachan used a whole cup. Actually, Strachan said, Walt, if you can make it as thick as mud, it'll be fine. But I start out with 1 quart of water, 1 cup of skullcap, make that infusion where it's a delicate herb. So you're making an infusion, not a decoction. And so you bring it to a boil, plumb turn it off. And when it quits bubbling, you're putting a cup of skullcap in there. Let it sit at least 30 minutes to overnight, and then drink on that throughout the day. Skullcap is amazing in calming that person with depression and anxiety down. Lavender is very, very good. You can use the lavender as the herb, or if you have an essential oil, it works well. I put a drop of lavender right here, rub it and breathe it. And then the next one, this is amazing, tremendously amazing. I can have a person come in with significant anxiety. Where they're talking different, where they're just about to blow up like Mount St. Helen, and I'll put 1 drop of lavender, 1 drop of vetiver, rub it here, and breathe it in. And it literally, I will see those folks calm down within 2 to 4, at the most 5 minutes. I've seen PTSD slow down, totally calm down. I had one guy, he had PTSD, and he came up to me one day. I was at teaching in where was I? Pikeville, Tennessee. And his eye, this eye right here was just going like this. This eye was stable. This eye was just going up and down, up and down, up and down. And so I got him the lavender. I got him the vetiver, and he put it on. He came back up literally within 4, I don't even think it was 5 minutes. We had symmetry between both pupils, and he says, it's gone. I'm totally calmed down. I have ladies that come in and they'll say, what did you just do to me? What happened? And it calms them down so much. I've got one day this lady she called me and she says, can I bring my husband and son in? They're having some major anxiety issues. I said, sure. So a little bit later, this lady comes in, a man comes in with her and a young boy, and they're like crying. The husband and the son are crying. They start hugging on each other, and they just hardly even talk to them. And I asked her, I said, what's wrong with them? And she said, this is what happens when we go out and we drive in the car. And so I went and got the vetiver and went and got the lavender. And I said, try this. And it's pretty cool. Usually you don't get your doctor say, let me try this drug and show you what it's like. And so I put the lavender on and I rubbed it in my wrist. You get it transdermally into the blood there. And then I put the vetiver, rub it on transdermally into the blood like a nicotine patch or a nitro patch. And then I'll just breathe it. And then now it gets into the lungs, back into and also into the blood. And I asked them if I could do that to them. They said, yes, I did it. They calmed right down. They left. A little while later, the lady calls me and she says, this has not happened in a very long time. They rode home and did not have anxiety. And it's just amazing how God will use these natural remedies to help with problems, and you don't have to have the medication. Yes, it's a little tougher with essential oils. Will we be able to have those? That may be tough, but we just keep searching and studying what is there that either in your local area that will grow where you are, or that you can naturally, or that you can plant and have. Just pray to God and say, God, I know a tough time's coming, and show me what I need to do now to prepare so that I can be ready, or my wife can be ready, or my children can be ready, grandchildren can be ready for these health issues that they have, and show us what we need to plant now. That's why you can't be in the city, y'all. You got to get out of the city now. I have people tell me, well, you've got your place in the country, and when things happen, I'll just come stay with you. I don't have that much room, y'all. And so I believe God has put it on us to have a personal responsibility to go out and get our own property. And it's got to be possible, or he would not say so. But there will come a time that we won't be able to. It'll be too late, where we can't buy and sell, where there won't be property available. We need to get out and do it now before it's not available. And even if you go, and people say, well, Walt, I'm looking for 20 acres. I'm looking for, this perfect land. Find what's available. And the other thing is, when you go look for property in the country, ask God where you need to go, because our job when we move to the country is not just to go hide. Our job is to go to the country, have that country property for our family and for ourselves, but also for us to witness to the people in that area. And you want God to put you in a neighborhood that your personalities are going to work good. I mean, some people just don't mix too well. And so ask God to put you in an area that you can witness to people. That's a huge issue that you need to ask for. And then some people tell me, they'll say, well, Walt, I'm looking for a place I can go and just hide in the country and nobody will know I'm there. Well, let me tell you what, when people move up on our mountain, everybody knows they're there. You can't just go into an area and hide. People know you're there. I remember when I first moved to where I live, I joined the local fire department, and there was a drought, and this old fella, he was actually one of the first fellas that started the fire department many years ago. And he looked at me. I walked in and he looked at me, and I saw him staring at me, and I said, hey, how are you doing? He goes, good. He goes, that old hemlock down below your cabin, is that flowing water? And I'm going, how does he know there's a hemlock down below my cabin and water flows out of it? And I said, how do you know about that hemlock and water? He goes, I hunted them woods all my whole life, hunting. He says, I know that property. Well, that man knows the property better than I know the property, because he'd hunted it his whole life up on the mountain. And I said, yes, it's that hemlock's there, but it's not flowing water. And he says, I didn't think so. I said, why? He says, the worst drought I've ever seen. And he said, he says, I've always seen that hemlock flowed water. And he said, I figured there's a good chance it wasn't flowing water. Those people know you're there. And so if you think you're going into country to hide, when you leave, go to the country, that is not a time to hide. It's a time to go and have country living for your family and to witness to your neighbors. And so when you do that, think about that. Now, when you're going to the country, also take a look and see, how can I plant these items? How can I plant the foods? How can I plant the herbs that I need to have for my family's health? And people say, well, what herbs do I need? Well, what health problems do you have? What potential health problems do you have? Write those problems down that you and your family, and maybe even your neighbors, write those down. Make sure those herbs they're growing. And if they're not, see if you can put them and start growing them there. So when there is problems with no buy, no sell, and they're having even some financial issues, you can say, Mr. Jones, would you like something for your arthritis? Or Miss Smith, would you like something for whatever the problem is? And that's the way you can witness to those people. A cold water douche. Now, this works pretty good for depression. What you do is you put a person in a shower, or you can take them outside, and you take a water hose and you put it plumb cold, and you go up and down the spine. And let me tell you what, that will bring them out of depression. It's amazing what a douche. That's one of my favorite hydrotherapy treatments is the douche. You can use it warm water, hot water, cold water, use it back and forth. But a cold water douche up and down the spine is amazing for waking that person up and pulling them out of that depressed state. Calming music is good for depression and anxiety, more of that classical kind of music. And there's different kind of classical music. You can have classical music that kind of gets you going in the morning. And then you have some that maintains you through the day. And then you have a soft, calming classical music that kind of calms you down in the evening. And religious music can do that too, the right kind. Omega-3s we talked about, where you're looking at the flaxseed. Also great for the brain is omega-3s that are in walnuts. Walnuts are great for depression, for brain function, anxiety. Pneumonia. That's another major cause of going to the doctor's office. You want a natural antibiotic. And there's different kinds. Alimed, I like Alimed, but if you don't have access to Alimed, use garlic. Garlic is antibacterial, antiviral, antifungal, antimicrobial, antiparasitic. So it's an excellent product that you can use. Golden seal, another great antibiotic, antiviral, that can fight if there's any type of viral bacterial pneumonia. Colloidal silver also works very well. Now, if you live in the country and if you live in the mountains, especially Appalachia, there's an item that you can use, and it's called, we call it yellow root, or it's yellow, Y-E-L-L-O-W, root, R-O-T, we call it R-O-T, but we call it yellow root. And yellow root is like a Siamese twin to golden seal. You can't buy it out there. You just have to go out and pick it. But it works just like golden seal. A little narrower fairway, but it works very, very well. Very similar to golden seal. And so God has, if you don't have golden seal where you are, maybe you have the yellow root. Or there's another one they call poor man's golden seal, and that's Oregon grapefruit. Another one that works very similar to golden seal, just not as well. Ginger, lemons. Now, lemons aren't as much so on their own. Lemon essential oil works better. It's stronger, but lemons work better in conjunction with other herbs. Then a revulsive hydrotherapy treatment to the chest. This is phenomenal. When people had COVID, one of the best treatments, if not the best treatment I found for the pneumonia was the revulsive hydrotherapy treatment. And you can either do one towel or you can do the back and the front. And the way you do it is you can put a shower curtain, lay it on the bed, then put your sheet back on the bed because you don't want to get the bed wet. And then you take a hot towel, and we're not going to have a microwave then, but you can just boil up some good water like we did years ago and wring it out with some gloves, but some rubber gloves, thick rubber gloves, and place that on the bed, put a barrier towel, lay them on top of it, and then take another towel, hot towel, put a barrier on the chest, then put the hot towel, another hot towel on their chest, and then lay a blanket on it for 3 minutes. Then you have them put their hands over the chest, sit up, and then take say a washcloth in ice water, or if you don't have ice, spigot, just cold as spigot water as you can get, squeeze it out and rub their back as fast as you can for 30 seconds. If you don't do a cold mitten friction, you can just use cold for 1 minute. Once you're finished, dry that off, and then you're going to put another hot towel down, another barrier towel, lay them down. Then you're going to do the same to the chest. Take that towel off, do the cold mitten friction for 30 seconds of cold, or put an ice cold or a plum cold towel on them, and then for 1 minute, dry it off, put another hot towel, and you do that back and forth. Again, the feet are in hot water. Their feet are kind of up in the air in the bucket of hot water. Keep that hot water hot during this process. And you can put an ice pack on their, a ice rag on their forehead or on their head, and keep that nice and cold. And you're doing this 7 times. So 3 minutes hot, 1 minute cold, 3 minutes hot, 1 minute cold. If you're doing cold mitten friction, 30 seconds. And you do this 7 times. Once you're done, then you clean everything off, take their feet out, put cold water on the feet, dry them off, and then let them rest there. Or if the bed's wet, put some different bedding down or put them in a different bed and let them rest there for 2 hours. And do that, at least twice a day. But a revulsive hydrotherapy treatment is amazing for pneumonia. The 2 big things there is the natural antibiotic to kill any infection and the revulsive treatment. Water, water, water. Very important for pneumonia. Steam inhalation, where you just take a bucket, put it over a fire or something, and you're making hot water, and it'll start boiling, and you can just get that steam inhalation, breathing that steam in, helps with pneumonia. Chest percussions. Chest percussions are good. Or we call it chest PT, chest percussions. There's another word also we use for it. And you take your hand, you cup it like you're going to drink some water out of a creek. Not flat, but you cup it. And then you hit their back about like this fast, bum, 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 bum. And you're hitting the back, and do it for a couple minutes. That breaks up any congestion there. And wives, this is the only time you can hit your husband. And it works very well. You can, hit that back and forth, and it breaks up what's going on in the chest, that mucus. Proning. And there's different ways of proning that folks did during COVID. One of the best ways that I heard of is where you can do it proning in the prone position, but they're on their side or whatever. But the best I heard was one hospital was using it, and you get on your knees, you lay down, kind of like some Arab putting their head on the floor when they're praying. So what you do is you, in the bed or on the floor, you can get up, if they can get up on their knees, lay their head plumb down on the bed or on the floor, and then have them cough. Now, you can also do the chest percussions during this same time to help break it up. And what happens here is that you're using gravity. It's kind of like when we used to do back blows. And you would lean them down low and hit their back, and that gravitational pull would help that lodged item to come out. I know they don't do back blows anymore, but that's because they didn't lean them down low enough, and they had them up too high, and it was lodging down the opposite direction. Back blows are great if you do it right. People just weren't doing it right, so they stopped them. But with proning, they're leaning over, have them do that every couple hours. Some people do it every hour. Cough, and that can help keep that fluid and congestion coughing out, and gravity helps with coughing that out. Another key with pneumonia is you want to keep that person rolling. Sleep on the side, sleep here, sleep here, sleep here, and it just prevents the progression. And I know when you have a patient who is non-ambulatory that may have bed sores or whatever, and that patient's prone to lay on their back, they can get pneumonia. So to prevent pneumonia, we have them turn every 2 hours back, side, back, side, back, side, and that keeps the chest moving, and it helps to prevent pneumonia. But here, when they do have pneumonia, it's still good to rotate to keep that fluid moving, and also to keep that coughing. It's good to have that movement. Rocket fuel. Now, rocket fuel is good for any kind of health issue, but we use rocket fuel. It's got, let me see if I can remember off my head here. I'm sure many of y'all have used rocket fuel, but I'll put 5 to 10 cloves of garlic. I'll use 2 lemons, a half an onion, an 1/8 to a half a teaspoon of cayenne pepper. Now, a cayenne pepper, depending on the heating units, because cayenne pepper can go from 20,000 to over 3 million heating units now. So it depends on how hot it is. Cayenne pepper, 2 tablespoons of honey, piece of ginger about the size of your thumb. I put some Alimed in it. I put in elderberry in it. If you won't have Alimed, you put some elderberry in it. So then I'll blend it up, and then they'll drink it. And it works very, very well for pneumonia. Mullein is the best herb for the lungs. And so a mullein tea works very well. If you don't have the tea, you can do an extract, but in this situation, you may not have access to the extracts, and you just make you a mullein tea. You're going to take about a quart of water, bring it to a boil, make an infusion. You're using about about a fourth to a half a cup of the mullein, where you've dried it and tore it up. And all you do is you just go out there and collect the mullein, hang it up like tobacco, dry it, and then once it's dried in a dark place, then you can rip it up, tear it up in little pieces, and put it in a glass jar or something, and that will preserve it. Another one is lungwort, another tea that you can use. It works very well for lung issues, for pneumonia. A saltwater gargle is good, and getting lots of rest. That's very important with pneumonia. Let that patient rest. You're still moving them every once in a while, coughing, turning them, but let them rest. A middle ear infection. Now, there's middle ear infections, there's inner ear infections, but what mostly goes into the doctor's office is reported as a middle ear infection. Inner ear infections can be either bacterial or viral. They're mostly viral. They can be bacterial. On the middle ear, that's the inner infection. The middle ear infection is normally a bacteria. And so what you do is, let's see here, a natural antibiotic. Golden Seal is my favorite. And here's how you do it. It's real simple. It's very fast. I take a teaspoon and I fill it about 70% of olive oil. And then I'll put enough Golden Seal powder in it that it still drips, but it's as thick as possible. And it's usually around maybe a half of a capsule, or just a pour. And normally I usually just take the powder and put it and stir it until I get it where it's as thick as possible. It still drips pretty good. You can warm it up if you want to a little bit. Don't make it hot. For an infant, you do 2 drops every 2 waking hours. For a child and an adult, you do 3 drops every 2 waking hours. And so you just lay them over on their side. I'll take, say, you can use a medicine dropper, or you can use the blade of a butter knife and put it in there and drip it off into the ear, rub it like you'd rub it down a dog's ear. And then, you know, those hot packs you use for hunting out in the woods, you pop it and it gets hot. Well, I use those now, but that may not be available. And so you can just take a hot washcloth or something and put that on there and keep changing it with some hot water that you've warmed up with a fire, and that will work really well. And you just take that off, put your drops in there every 2 hours, put that back on there. We normally see ear infections gone in less than 24 hours. It's not surprised. I'm never surprised to see it less than 12 hours. It's amazing. You want heat to the ear. Another item you can use for the middle ear infection is an ear candle. And we've seen some really good benefits with using ear candles also. Back pain. Another major reason people go to the doctor. Hydrotherapy is very good. If the pain just occurred, you want to wait 48 hours. Now, we used to do 24 hours. And then they said that's not long enough. So it went to 48 hours. Now we see orthopedists saying, no, 24 is fine. So pray about it. See, 24, 48 hours, definitely over 48 hours, you can start using hot. But the first 24 to 48 hours, you only use cold. Then after that, you'll use hot if you're doing the hydrotherapy. Now, here's an interesting thing. You will have some patients that have back pain who can tolerate hot, but can't tolerate cold. You'll have some patients that, can't tolerate, vice versa. So one can tolerate hot, the other one can only tolerate the cold. So you have to find out what your patient can tolerate. Putting them through a bunch of pain is not going to help, that situation. So use the temperature that works best. If they can only tolerate the hot, just wait 48 hours, and then you can start putting the hot on there. The problem is when you bring hot to an area first, you have more vasodilation, and you're bringing too much blood to the area too quick. You're more prone to the edema. Copaiba. Now, copaiba is it is the most anti-inflammatory herb that we found so far. It is powerful. It comes from the copaiba tree, and the tree, they'll tap it. It's around 30 to 50 years old. It's kind of like tapping a maple tree. Put 2 drops under the tongue twice a day, 3 times at the most. You can rub it over an area, like you can put some on, rub it in the back, and you don't want too much. You can mix it with a carrier oil, and you can do that. And that is amazing how anti-inflammatory copaiba is. Whether or not you can have access to it or not is the challenge. Capsicum cream works really well, and capsicum is what's in cayenne pepper. And you don't have to buy it. You just make your own. So you grow your own cayenne pepper, and you can make some kind of a cream. And what I'll do is I'll take the cream, put it in my hand, put the cayenne pepper in there, and kind of mix it up until I get kind of a pink color. Again, the problem with cayenne pepper is the heating units. You don't know if it's 20,000. You don't know if it's 3 million. So I take a bit of it, put it to the back of my hand to test it, kind of like you check bottled milk for a baby on the back of your hand, and if it's too hot, you just add more cream. If it's not hot enough, you add more cayenne pepper until you get that right feeling. Then you put that on the back, and that works very well for back pain. Another one is turmeric. They can take turmeric by mouth, and that's a great anti-inflammatory. Garlic, you can take garlic by mouth, and that's another great tool for back pain. Valerian, that's an herb. You can drink the valerian tea. You can also do valerian fomentations, where you make a tea and dab your fomentation down in it, wring it out a little, and lay it on top of them. It's warm, so transdermally it's going to go in really good. And you can make like a poultice, but it's called a fomentation of valerian tea. Arnica, that's another one that's been used for many, many years. And I like using it. And arnica, you can use it for back pain. Devil's claw is another one. They use that in Africa. Rosemary. Boswellia, that's the same as frankincense. Peppermint. Now, essential oil of peppermint, this is really cool. 1 drop of peppermint essential oil, you have to drink 28 cups of peppermint tea to get the same medicinal benefit. So if you have access to the boswellia or frankincense, or access to the peppermint essential oil, the rosemary essential oil, it's going to work a lot stronger. The challenge is, do you have access to it? Pomegranate is good. Lobelia. Lobelia is if you take low doses, it's an antispasmodic. If you take a high dose, it's spasmodic, kind of like the ipecac, syrup of ipecac. But if you do a low dose, you can make a fomentation of lobelia tea, and that stops spasms. Works very, very well transdermally into that. In the mountains they call it lobelia, but it's lobelia. Cherries, eating cherries can be beneficial. Birch essential oil, Epsom salt works quite well. Blackstrap molasses. Blackstrap molasses works a lot. It has a lot of magnesium in it. They can take the blackstrap molasses by mouth, or you can put the blackstrap molasses onto the back. And actually, you can use, there's a massage that we do using blackstrap molasses, which is quite interesting. But you can do it by mouth. You can also put it on the area and then take it off. We do blackstrap facials, and it's tremendous, putting nutrition into the face. Magnesium rollerball or spray, that's a tremendous little tool if it's available at that time. It's magnesium oil, and it works very fast transdermally, actually faster than by mouth. Beet juice, ginger, another good one for anti-inflammatory. MSM, excellent. We talked about that earlier for arthritis. Another one works very, very well for inflammation. Again, far infrared if the person has availability to it. And a big one for back pain is get the rest. Get the person's, they need to have sleep. You got to get that person to sleep. That's very, very important. Reduce stress levels. That stress will tighten the nerves. Again, if you need something for pain, the wild lettuce tea, the Jamaican dogwood, the California poppy, and the skullcap works great for pain, that person can work through that pain of the back pain. Dermatitis. This is the last one, and it's the 10th one. You want to remove the possible causes. And dermatitis, skin issues many times are blood issues. but they also can be topical issues, and you want to find out what that cause is. It could be food allergies such as wheat, gluten, eggs, peanuts, citrus, soy, dairy, tomatoes, corn, shellfish, fish, or it could be allergies to metals like nickel. It could be an allergy to rubber or latex, grooming products, cosmetics, antibiotic ointments, fabric detergents. And that's one of the first things I look at is when a person comes in. Have you changed your detergents that you're washing your clothes in? Household cleaners, fertilizers and pesticides, musical instruments. Now that's a weird one, isn't it? Musical instruments. How can musical instruments affect dermatitis? Well, things like trumpets, trombones, baritones, saxophones, flutes, they're metal. And a person can literally have an allergy to the metal in your music instrument, thus causing the dermatitis. Now, treating the dermatitis, for years we used calendula, or some people say calendula, and you can either make a calendula tea, or I like taking and making a calendula oil. And the way you do it is you take a cup of olive oil, bring it to a low heat. Be careful, you can scald it. Put in a handful of calendula or calendula, dab it down in there really well until it's totally covered up, and let it at that low heat with the top on the pot simmer at a low simmer. And I like using a crock pot because it's really low. And you can heat that for 2 hours. You can use a pot on the stove if you can really adjust that heat. Be careful, it scalds. 2 hours, turn it off, let it sit overnight. The next morning, I'll pour it through a kitchen strainer, and then I'll take the flowers and I'll put them in a bag, and I cut the tip out of the bag and I squeeze it, kind of like milking a cow, and like you would do cake decorating, where you squeeze that icing out of it, and so you squeeze it, and you get as much of that oil out of the plant material, out of the calendula flowers, out of it, and you have the oil. Throw then the bag of calendula flowers away, and then you take that oil and you can apply it to the affected areas as needed. Works very, very well. Or you can just get a calendula cream, but at a time of buy no sell, you're probably not going to be able to get the cream. So you can grow the calendula, and then that way you have something for skin disorders. Psoriasis, eczema, rosacea works quite well. Or y'all used it the other day there, I believe, on a boy that had an issue, and it works great for my youngest son. Got stung one time. He's allergic to bees, and Dr. Nelsie Restrepo out of Colombia, South America, she happened to be doing a locum tenens with us, and she made some calendula tea real quick. We dabbed his literally one eye was swelling shut. He was going across his nose. The other eye started swelling shut. I was concerned about airways. She made the tea, put it on here, just kept dabbing it on here, and the swelling went plumb away. Works quite well. Oatmeal baths can be used. Blueberries, blackberries, eating them. Omega-3 fatty acids, probiotics, vitamin C, bromelain, quercetin, vitamin D, evening primrose oil. Those are some of the things that you can do for the dermatitis issues. So when you look at addressing health issues, there's so much to cover in just 2 hours. I encourage you to go to Amazing Discoveries and get the Old Mountain Remedies, get the herb cabinet, get those 2 sets, and that's going to give you a lot more information. But when you go into getting ready for health and no buy, no sell, take a look at what you can do to prevent it from happening. You know, you prevent yourself from getting hurt in a car wreck when someone comes across that line. You definitely minimize that by wearing a seatbelt. You have a fire extinguisher at the house. You buy things at the house that doesn't have cheap cords on it to prevent a fire. Take care of your health. Use those laws of health, and you're less prone to get those, especially chronic diseases. And then ask God to be with you throughout the day that you aren't hurt. and then prepare. Have the gardens of herbs and things which you can use to naturally address those different issues.
This presentation was filmed at our 2022 camp meeting on site in British Columbia. If you would like to join for the next camp meeting, visit our events page for details: events.amazingdiscoveries.org.